It's the art of dentistry. Dr. Robin Rutherford.
Welcome back. Well, going to the dentist can be scary, from those weird smells to the sounds of the drills. It's understandable why it makes some people uneasy, but there are ways to make you feel more comfortable. In today's Art of Dentistry, Dr. Robin Rutherford joins us to explain the option of sedation. Dr. Rutherford, thanks for being here.
Glad to be here. Always enjoy it.
Yes. So first, why do people get so nervous going to the dentist?
Okay. Some people have no problem going to the dentist and they're just comfortable and relaxed. But I think most people are at least a little bit nervous, you know, a little tense. Yeah. And some people are just really, really scared. So it's just a big spectrum there of how people react. But the things that people tell me is sometimes, oh, I hate the sound, you know, of the drill or something. Some people tell me, I hate the smells, the scents, you know. They don't, maybe they're claustrophobic. And so leaning back with somebody working on their teeth, you know, is like sort of a hard thing. You know, people go, oh, let me sit up, you know, and I recognize that as being claustrophobia. So there's a lot of things, you know, pain. People say that I can't get numb. It always hurts. They do whatever they can for me and it still always hurts. That's somebody that would be so much happier if they were just asleep. Okay. Right? And the sedation works that way.
Okay, so tell us a little bit about sedation. When do you use it?
Okay. Well, I'll tell you, my first experience was not actually in dentistry. When you hit 50, you're supposed to have a physical. So my physician says, okay, you got to go to the heart guy. He says you got to have a colonoscopy, this, that, and the other. So the colonoscopy physician says, okay, we like for you to use sedation when you do this. And I didn't know the difference, so I said, okay, whatever, I'm good. So we did the sedation thing, and the next thing I knew, I was just waking up, and there's my wife over there reading magazines, waiting for me to wake up, you know. And I thought, you know, that was a great way to do that. And when I really thought about the colonoscopy, I said, you know, there wasn't really anything I wanted to be in on with that anyway, and so sedation with dentistry is the same way. People, you take a couple little pills before you get to the office, and maybe we give you a little more if it looks like you need a little more where you're just right. And then you just, generally, people go to sleep.
Oh, wow. So do you use it for just a cleaning as well?
It can be. Sometimes it's things that you go, ooh, scary, you know, wisdom teeth, root canals, whatever sounds scary. But a lot of people like to be, I just don't want to be here for anything. You know, so even to have your teeth cleaned routinely or something like that, sedation.
Awesome. Okay, so let's talk about this machine. Is this part of it?
Okay, yeah. Sedation is very, very safe. Like I say, we adjust how much we give you to whatever seems like is just right for you. But this is a sedation monitor. I'll turn it on here. It comes on with the little red lights and stuff. And it comes on with numbers. While we have you there with us, we want to just always know how you're doing. And first of all, you're not unconscious. If I want to say, okay, open wider, Alexa, you can open wider. If I say, okay, turn your head this way, I can ask you a question, you can answer. Just tomorrow, you don't remember it. That's what's so great. But, for example, this is called a pulse oximeter. So you just put it on your fingertip there. And it gives a readout here in a couple of seconds. The top number here is your heart rate, how fast your heart's beating. And then the number right under that will be the oxygen level of your blood. 100 is the maximum, so 97, 98, something like that is ideal. So I get a readout all the time of how you're doing. It also has a blood pressure cuff, and so we hook you up on that, and it just automatically takes your blood pressure every 10 minutes. So I always have a feel for how you're doing. Plus, you're not unconscious. It's so safe. It's not like having a heart surgery or something where you're truly unconscious. And so, yeah, you're totally safe. It's good. We've never had a problem.
How am I looking? Am I good?
Oh, what are your numbers there? 93 beats per minute and 96 is your oxygen. So yeah, you're a healthy young person. Good for you.
Awesome. So let's take this picture right here. What are you showing here?
Okay, this is a patient of ours. Just showing you what it looks like for somebody that's sedated. You can see the pulse oximeter and the sedation monitor on the cabinet over on the other side, and there's the pulse ox on her fingertip, and she's just kind of happy and relaxed and asleep.
Right. So if anyone is nervous at all, they can just come see you and you can help them out.
Yeah. No matter what kind of dentistry we need, even if it's just cleaning or if it's something that sounds like a big deal, We do this every day. I've done over 3,000 sedation appointments in the last 20 years. There's probably not a day that goes by that we don't do a sedation appointment. I did 3 already today where we did various things for the various patients. And so we're completely used to it.
Awesome. Well,
So
Dr. Rutherford,
it's the best thing that's happened in the last 20 years.
Yeah, it sounds great. I need to come to you. Thank you, Dr. Rutherford.
Thanks.
It's the